Hello YouTubers, how you doing? How you feeling this week? Let me know in the comments below. Give me a little thumbs up and hit subscribe while you're there. It really helps support my channel. This week is for the ladies, so if you're not interested in learning about the links between Lyme symptom flare-ups and menstrual cycles, this video is not for you. Go ahead and skip this one. But if you are going to stick around, just a short disclaimer, I'm not a medical doctor, this work has not been reviewed by a medical doctor, and this should not be taken in lieu of medical advice. I'm just sharing my research and experiences with you. First, just kind of a Cliff Notes version of what I was dealing with before I got Lyme, and then what I'm dealing with after Lyme, and then we're going to dive into some of the research and interesting things I found out. So my very first cycle was around 13 or 14 years old, and it was extremely painful. I remember vomiting from the pain, not being able to stand upright, missing days of school. Around age 15, they told me I had endometriosis and put me on birth control pills, which were supposed to give me a more regular period and help me, help manage those cramps. However, I never really experienced any relief, and for whatever reason, I just continued taking the birth control pills. At age 19, I had menopause induced. This doctor thought that it would give my uterus time to heal. I don't know. I didn't ask nearly enough questions being 19 years old, but she gave me a shot in my arm and it stopped my period, or was supposed to stop my period for 6 months to a year. However, it never really stopped my period. I continued to have spotting and severe cramps despite having that shot, and it took me really like 2 years to get recovered from that and actually have a normal period again. So despite not having much relief, I continued taking the birth control pills until I was almost 30 years old. And then I started learning a little bit more about what these hormone pills do to us and decided to get off of them. Ironically, around age 29, I got infected with Lyme disease. However, I was misdiagnosed with arthritis, and that's a whole nother video in itself, which I'll link above because I have a video about it. But I, didn't know I had Lyme, but I thought I had arthritis, and was getting off the birth control. So, all that weirdness that was going on at the beginning of my Lyme infection, I really just wrote it off as if it just was not, just I'm turning 30, whatever. So my period started getting a lot worse. I started getting a lot more fatigue. I started getting, which would have, in my mind, I was thinking, okay, my body's just recalibrating from getting off these hormones for 15 years. But looking back, I'm like, oh, Lyme could have been messing up all those cycles as well. And I was really having a lot more fatigue and just severe cramps, vomiting from my cramps, and not being able to really get out of bed or get away. Like, I just always have to have heat on my abdomen or else I can't stand up straight. So about 2 years ago, so this would be around like age 36, I started experiencing very heavy bleeding, like filling my Diva cup in 20 minutes, heavy bleeding, and just didn't know what was going on. I went to get a ultrasound and all of that jazz, and and I forgot, at the age of 19, when I got that shot in my arm, I actually I was dealing with a cyst that was popping on my right ovary, so it was filling up and then popping pretty much every cycle. And I think that was like another reason why this doctor was like, well, just stop your period. But I believe that this cyst on my right ovary has just burst and refilled and burst and refilled pretty much every cycle my whole life. And about 2 years ago, it started just being really heavy bleeding, and so through these ultrasounds, they tell me it's now a hemorrhagic cyst, which They didn't really tell me what kind of cyst it was before. It could have been hemorrhagic, just bleeding inside of my body, but now it's, for whatever reason, like coming out. So pretty much every period now, I feel like I am bleeding to death. It's like so difficult to even leave the house or anything. Like I'm changing my Diva cup like every 20 minutes. During my sleep, I bleed through absolutely everything, like pads, bleed-proof underwear, my sheets, my mattress cover, into the mattress, like everything. The first 3 days or so is like crazy bleeding. I also have been dealing with low iron now, so I feel completely drained by my period every single month, and my Lyme symptoms will flare up. So I deal with arthritis type symptoms, especially in my knee. So that's flaring up. You know, that'll flare up like a few days before my period. I feel like I get more fatigue, I get brain fog, I get headaches, I get swollen, painful joints, and digestion upset as well. Then yeah, I pretty much have been just tracking my cycle, and I know that I'm gonna need like 3 or 4 days off to just rest, and I like prep my food and everything for those days. Like it's just like I'm staying in bed for those days every month. So I have been, you know, learning what I can about hormones and all of that stuff, and I actually got the Dutch test done thinking that it must be like a hormonal thing, because the rest of the month, my Lyme type symptoms are very mild. I'm like pretty functional during the month until just a few days before my period, and then I'm just laid out for basically a whole week. So I was like, it's gotta be my hormones, right? But I get this extensive Dutch test done, and every doctor I've had look at that, it's a very extensive hormone test, if you don't know what that is. Every doctor that has looked at that is like, wow, your hormones are great. And I'm like, really? Okay, so it's not that. But no one took the time to explain to me like what your cycle does to your immune system. So I've been doing some digging and wanted to share some of the stuff I learned. I'm definitely not an expert in hormones, but I'm going to do my best to explain that this is actually pretty in line with what our bodies are doing. I forever have thought that like when you're on your cycle, your immune system is like weakened. You're just like, you know, your hormones bottom out, you're just depleted, and this is like your inner winter hibernating zone. But comes to find out, it's actually not the case. We are actually they have linked high inflammation and high immune response during our menstrual cycle. So there's 2 phases to our menstrual cycle, the follicle phase and the luteal phase. And the follicle phase is day 1 of your period to day 14-ish when you begin ovulating. Then the luteal phase is day 15 to 28 or 30, however long your cycle is. So essentially during the follicle phase, day 1 through 14, day 1, your hormones are very low and your estrogen starts boosting, pumping up in preparation for ovulation. Right at ovulation time, it starts to dip back down, and they've linked estrogen with higher amounts of inflammation and immune response. So theoretically, this could be, you know, nature's way of protecting the body so that it can get pregnant. So our immune response is like on fire during our menstrual cycle. It dampens down at time of ovulation so that the body can, you know, allow that foreign invader into the egg to, fertilize and have a baby. So our immune response is actually lowest around ovulation time. Usually, like in a healthy person, having that high inflammation during our menstrual cycle may protect people from getting, you know, a cold or a flu. But if you've got chronic illness, chronic disease, chronic inflammation, you could actually experience a worsening of symptoms during that follicle phase. During the luteal phase, day 15 to 28 or 30 of your cycle, you are actually having less immune response. This is actually like opposite of what I thought was going on. It's pretty interesting that, you know, we're not really taught a lot about how our cycles work. And in fact, we need a lot more research on how the female reproductive system works. Something else I found really interesting is that we actually metabolize drugs differently depending on which phase of our cycle we're in also. So it's kind of almost a double whammy here, because as you're menstruating, you know, your inflammation is high, you're probably experiencing more symptoms, and then you're metabolizing your medications differently, which I had never ever heard before I started digging into this, and that was pretty fascinating. So let me know in the comments how your menstrual cycle impacts your Lyme symptoms. This is something definitely needs a lot more research, and I'm going to share a couple ways that I have been managing mine, and let me know in the comments if there's anything that's been helping you as well. So a few ways that I have been kind of managing this is definitely by tracking my cycle and just keeping a journal, like day 1 of your cycle, write down a little paragraph about how you're feeling emotionally and physically, and keep track. And you know, around like 4 or 5 months, I really started getting in click with the patterns that I have, and our energy, our emotions, everything is cyclical. So if you are tracking your cycle, you're going to start to pick up some of the patterns that you have, and it's going to help so many areas of your life. I highly recommend this book, The Blood Book. This was such an eye-opener for me. I really love how the authors tie our cycles with the seasons. The menstrual cycle during the bleed is considered your inner winter. That's kind of like your hibernating time. And then your ovulation is inner spring, inner summer, and inner fall. And it really helps explain some of the waxes and wanes in your energy, your moods, your emotions, your likes and dislikes, all of that. Really helpful book is in here. Has some really incredible food and supplement suggestions in here as well. And I, of course, am a big proponent of pranayama breath work. I'll go ahead and link a video up above that I use often. Essential oils, supplements, anti-inflammatory diet, heating pads, and just being really kind to yourself. Again, like starting to track your cycle so that you can kind of schedule yourself, let your spouse know, like, what's going on, how they can support you, because this is going to come around every 28 to 30-ish days. So it's so helpful to know and plan it out ahead of time. All right, so that's pretty much all I have for you today. I wanted to just kind of explain a little bit without having to try to pronounce the names of the hormones or like, you know, try to explain what these hormones do exactly. I hope that was helpful to you. I have more information. I'm going to put some links below from the sources that I used for this if you want to dive in yourself and learn more. And I'll probably do another video on this in the future. Let me know in the comments what you like to learn more about. I'm trying to make a video each and every week. So again, hit that thumbs up if you enjoyed, and hit subscribe